Welcome, everyone. Thank you so much for joining us for today's webinar, Navigating Sex and Intimacy While Living with Pulmonary Hypertension. My name is Kimberly Brunel, and I am the Manager of Support and Education here at PHA Canada. I am coming to you today from Mississauga, Ontario. So I'd just like to take a moment to acknowledge the lands which constitute the present-day city of Mississauga as being part of the treaty and traditional territories of the Mississaugas of the Credit First Nation, the Haudenosaunee Confederacy, and the Huron-Wendat and Wyandot nations. We honor the Indigenous peoples who have stewarded this land for generations and continue to do so. We are grateful for the opportunity to live, work, and learn on these territories. So without further ado, I'm so pleased to introduce our two speakers for today. Dr. Sarah Vargas is a research scientist at the Miriam Hospital and assistant professor of psychiatry and human behavior at Brown University Medical School in Providence, Rhode Island. And Dr. Vargas and Ventetuolo is a clinician at the Rhode Island Hospital Pulmonary Hypertension Center. She's also an associate chief of the Division of Pulmonary and Critical Care Medicine, and also the associate professor of medicine at Brown University Medical School, also in Providence, Rhode Island. I will stop talking and happily pass it over to the two of you. Thank you so much for joining us today.
Thank you for having us, Kimberly. And
Sure.
hello, good afternoon or morning, depending on where you are, to everybody who's joining us. As mentioned, my name is Sarah Vargas. I'm a research scientist. I've been doing behavioral medicine research for about 20 years now with a focus on sexual and reproductive health. For the past 5 or 6 years, I've been fortunate enough to have the opportunity to work with an amazing team of researchers and clinicians in the pulmonary hypertension space, merging our research interests and our work in sexual and reproductive health, quality of life, and pulmonary hypertension. And that's what we're going to be talking about today. I do want to reiterate that I'm a researcher, not a clinician. And so I will be sharing a lot of the insights from our work and work of other folks in the field, which because this is a relatively new area with not a long research history, I'm pretty much able to cover nearly every study that is out there right now in this topic area with you all today, at least to some extent. And then talk about a guide that's out there that you may or may not be familiar with that has some recommendations based on clinical observations and research of addressing sex and intimacy when you have pulmonary hypertension. Not being a clinician, I'm also going to do a lot of the presenting, but potentially send a lot of your questions over to Dr. Ventetuolo, who's here, and I'm going to give an opportunity just to say hello and introduce yourself if you'd like to take that for.
Sure. Thank you, Kimberly and PHA Canada, for the opportunity, and thanks, Sarah. Thanks to all of you for joining. I'm first and foremost a human who recognize this as an important topic, and that probably many of us as physicians and care team members don't get to in a routine office practice. But I think we started studying this some years ago now because patients over the years have mentioned stuff to me that I haven't been able to explore enough. And so we want to know more about how PAH impacts all aspects of your lives. And so that was the sort of the inspiration for this work. So I'll let Sarah take it away, but also can provide kind of the PH clinician input as needed. Thank you.
Yeah. And kind of piggybacking off of what Dr. Ventetuolo was just talking about. So we've sort of brought together this research, noticing that as treatments advance, people are feeling and functioning better, living longer. We're doing a better job of getting the right treatments to the right patients, minimizing side effects and the burden of those treatments, that it is increasingly on our radar to learn about what's going on for people outside of those clinical visits in what we call quality of life. And this is a term that I'm sure many of you are familiar with. I have the official definition here from the World Health Organization, but really this just is about your perception of how you're doing. And it falls into a number of different domains. So you can see those different areas that are related to quality of life here on this slide. There's your physical health and functioning, psychological and emotional, how independent you feel you're able to function in your life, the social relationships you have, the environment around you, and broader things like spirituality, religion, your belief system. And now these are not just things that apply to people with pulmonary hypertension. This is everybody. This is a term that we use in many different domains, and we are increasingly researching this and also figuring out how best to insert it into your clinical practice. The limited time that you may have with your providers, how are we making sure that people are addressing kind of everything that's going on for you, not just the acute physical issue that might have you coming in to see them that day? My area has always been sexual and reproductive health, so this is where I merge with Dr. Ventetuolo and other physicians and clinicians that we work with. But it really taps into a bunch of different domains that I just mentioned. These are all areas that are related to your sexual health, intimacy, and relationships, and might be particularly affected when you have something like pulmonary hypertension. Your personal relationships, your mobility, ability to get around, move around, your body image, your appearance, your energy level and fatigue, sexual activity itself, any pain and discomfort you might be experiencing, and that self-esteem, how you feel about yourself and your functioning. So this is really the domain that we're going to be talking about here today, is this quality of life with a particular focus on sexual health related quality of life. Now, when I have done looking into research to support the research that we do, and for this presentation today, doing kind of an updated search, there really are only a handful of research projects out there that have actually published information about this topic. And I'm going to share with you all what does exist in the research domain and what are some of the takeaways from that. They are broken up into 3 different categories. There are surveys that have been conducted with patients, with people that have pulmonary hypertension. There are interviews that have been done to shed some additional light and give some additional depth to the topic with, again, the patient populations. There's also one study that looked particularly at providers and clinicians who are working in the pulmonary hypertension space, just to kind of find out their perspective on how much these issues are being addressed. And might not be shocked to learn that even the providers themselves, as Dr. Ventetuolo pointed out, realize these things are being under-discussed in many situations. So there are 3 studies in particular, and now you'll also see here the numbers that we're talking about. So we have some insights from what is relatively small groups of people, but I think, pretty consistent, the messages that we get from project to project, with a few different differences that I'll explain in a few minutes. But these are some of the studies that have focused on doing surveys, so questionnaires with people that have pulmonary hypertension. Our team is the Banerjee project from 2018. So we actually did surveys and interviews with women in particular at a US-based PHA, Pulmonary Hypertension Association conference. That was back in 2016 when we did the original interviews. And then there was 2 more survey studies done in Brazil and the Netherlands. The other thing you'll notice about this is it is not just based in the US or Canada or the North America. These are global studies that we're seeing as well. And this is the different populations. So we have 2 done just with women. And 1 that surveys both women and men, particularly with pulmonary PHA and CTEPH. So what are some of the things that we take away from these surveys? Well, one thing is that people who participated in these surveys reported levels of sexual dysfunction that were similar or approaching other groups of people who had been formally diagnosed with sexual dysfunction. And so that means about 2/3 of people who have taken part in these studies that I just showed on the last slide have reported some level or functional impairment that would rise to the level of sexual dysfunction as we define it. About half of the men in that one study reported issues with erectile dysfunction in particular. And then some other specifics are specific symptoms that interfere with sexual activity, in particular, shortness of breath, palpitations, and pain. And in terms of how that impacts the sexual experience, some of the most commonly reported situations are difficulty reaching an orgasm, not having enough lubrication, experiencing pain, or reduced sexual satisfaction. So just overall kind of evaluation of how your sexual encounters are going. We also know from these studies that it's not just the disease or the symptoms that are affecting people. It's also age matters, especially when we look at some of the more physical indicators like lubrication and reaching orgasm. And also things like poor functional class, which is related directly to the disease, of course. There is some mixed results about whether type of treatment matters or not. So whether you're on an oral treatment for pulmonary hypertension or on something like a pump, we see both. In some studies, it has not been associated with how much people are reporting in terms of sexual symptoms. In other studies, we have. And I know that in qualitative interviews, which I'm going to talk about a little bit, we do hear people talking about the experience of trying to have sexual encounters while they have something like a pump for treatment. The other thing that we can take away from these surveys is that question of how are we addressing this? And so one thing that we know is that traditional measures of quality of life, things you might see when you go to your doctor. The Emphasis 10 is one survey that people use, I think, in research and clinical settings. They're not really picking up on this experience of sexual health related quality of life. We know that because it is just, we are seeing things come out in these sexual health scales that are not coming out in your run-of-the-mill traditional quality of life measures that are being handed out in research studies or in doctors' offices. Another thing is that one of these surveys also asked people who participated if they were interested in talking to their healthcare providers about sexual health. And most, about 67%, said, yes, I would like to talk to a healthcare provider about this. And I think that that is another thing that as we dig a little bit more into some of the other research projects, we'll see that's also a very mixed bag in terms of whether those conversations are actually happening or not, and also who's initiating them. If, the clinicians are bringing that forward, or if it's things that patients are bringing to an appointment. Now let's talk a little bit about some of the interviews that were done. So I get very excited about this section because I am a mixed methods researcher, which means I do surveys and interviews. So more traditional, paper, pencil, answer questions, as well as sitting down with people and in a more open-ended way, hearing their story. So this is from the latter. This is from talking to people and asking them to share, giving them specific domains and questions, and then really encouraging them to share additional details that we might not capture in your traditional standardized type survey. This project, there are two of these that I'm going to discuss. The first one by Daniel Yee from 2022. This is also from our group. And then the other study was a different research group that we were not directly involved in. So from our project, we learned a number of things that echo what I've just shared about the surveys, and then also add a bit more nuance and detail to the experience that people have. So most people discussed having less frequent sex after they were diagnosed with PH. I underline discussed because I do want to highlight that for this portion, which is the interviewing portion of the research, it's a little different than a traditional survey where everybody gets asked the same question in the same way, and they usually get the same response options. In an interview like this, we usually tend to kind of go more with the flow of the conversation and let people share what's on their mind and what's salient to them within some topic areas. So when I say discussed, it doesn't mean that that 13th person did or didn't have more or less frequent sex. They didn't talk about that particular issue in the interview, so we don't know. So just keeping in mind that all of this stuff, when I give percentages here, they might be a little bit misleading because we don't have a really good count like we might in a survey project. But this, again, we use these methods because it offers a lot more detail and kind of understanding about the how and the why people are experiencing things the way they do or answering questions the way they do on the surveys. So I'd like to give that caveat. So I've also added in here, you'll see some quotes. When you see quotation marks, this means quotes that were shared by people who participated in the interviews to kind of illustrate some of the points that I'm making here. I didn't do it for everything. I used it somewhat sparingly, but these I think are some really good representative quotes of what people said. So in addition to mentioning that there was typically less frequent sex after they were diagnosed, they talked about some of the reasoning behind those changes in their sex life. One thing is this idea of fear related to sexual intercourse, and a lot of fears. So fears of performance anxiety, fears of having symptoms increase, fears related to pregnancy because pregnancy is contraindicated, and doctors, do I think a more thorough job of covering reproduction and pregnancy than perhaps the broader sexual health topics. So that all kind of feeds into people feeling really scared, and that emotional state can be really hard to get comfortable in a sexual experience. So people talk about that a lot in these interviews. Additionally, about half of the people talked about some type of body image concern, be it side effects of their medication related to weight gain or bloating, to having things like cannula from the oxygen that's just a physical presence when they're trying to be in a sexual situation. Those are other concerns that the people in this study brought up. But on the kind of flip side, everybody talked about the things that you can do to work around some of these concerns that they're expressing, and strategies that they have. And then also this idea in that last quote there, your sex life isn't over just because you have pH. You just need to be more creative with it. You need to try different things until you figure out what works for you. So there is that. Here's some of the concerns that we've been up against. Here's some of the ways that we've managed to work around it. A little bit more from the same set of interviews. As I've already mentioned, similar to what we found in the surveys, yes, people say that the symptoms of pH and the treatment that I'm undergoing affects how often I want to have sex and the types of positions that I can use for many reasons. But here's some other things that they say. There is a difference between desire for sex and physical limitations. There's often a disconnect people have. It doesn't necessarily mean that they're not thinking about sex. It's not an important part of their life any longer, but they feel like maybe some of those physical or emotional limitations are insurmountable. We talked a little bit about fear and then avoidance. And then also there's, not just coming from the individual that is dealing with the diagnosis, but also their partner. And partners can worry too. Some of the things that people expressed, he meaning this person's partner, he's afraid of interfering with the pump. I think he's scared more than me. He's scared to touch me. So they also shared this idea of trying to handle their partner's concern when it comes to engaging in sexual activity after you have the diagnosis of pulmonary hypertension. And this is where we're really able to even further dig into some of again, that how and that why behind the things that people are saying. It's not just a number on a page that, yep, I had sex half the amount or whatever that number is on your frequency of sex that you might fill out on a survey, but also the more complicated internal experience that people are having and how they're thinking about and dealing with that. So guilt was also a theme that came up a lot. People felt guilty about declining to engage in sexual activity or not wanting to have sex because they were too tired, because they were scared. They felt more broadly guilty about how much time things just take up in their lives. Even if you take it outside of the bedroom and the sexual domain, just the additional chores or things that might be getting put on their romantic partner, they're concerned to then have another area of their life where things are changing. That was another topic that came up. And for some people, these changes did lead to relationship conflict. For instance, one person said, I think you'd feel like I was rejecting him when really it's just that I was tired and couldn't breathe. So what a lot of this comes down to is really a few things. Communication being one of them. We're going to talk about that when we talk about some more of the projects and the recommendations. And also this idea of sort of creativity as two big things. And the information that was shared with us in these interviews was a true weighting between the challenges and the way that they have overcome or have dealt with some of these things. So some of the things that come from these patient interviews that they recommended in terms of, they say, sex is still important to me. If sex is still important to me, I am going to focus on ways that I can incorporate that into my life in a different way. And here's some of the things that we heard from those patients. Understanding and talking about physical versus emotional intimacy. So it's not just all about a sexual encounter. It is about the closeness and being in a relationship that comes around that. So if you're communicating, you can talk about your needs in these different domains and try to figure out something that's going to work. Valuing the quality of sex over the quantity of sex was another thing that people recommended. One person who participated in this interview said, we may not have sex as often as we want, but it's much more meaningful. Focusing less on some of the physical things like having an orgasm that may be challenging given some of the limitations that people might experience, and some of the other things, again, that come with intimacy. And also just a lot of practical suggestions, like finding a new position, using pillows or props, engaging in more foreplay. These are things that people were doing because they wanted to have a sex life that was satisfying for them and their partner, despite some of the challenges they were facing. The other group of interviews was done with women in Italy. So again, this is very cross-cultural, around the globe type stuff that really kind of comes up repeatedly for people. You see a lot of the same types of themes coming up for everyone. And in this group, they presented their work as 4 main themes. So they presented the individuals describing what happened once they were diagnosed with PH, how that affected their intimate relationships. And some of that was, avoiding meeting new people if they weren't in a current relationship. Some ended relationships, some grew deeper in their relationships. So I think there's really just a lot of things that are very normal. People react and handle things in very different ways. And in this project, all of those were covered. In a group of only 25 women, you had people having all these different experiences related to post-diagnosis. A few more quotes here. There was specifically here, they focused a little bit on this, how do we get sexual health information? And this is where I mentioned earlier, a lot of patients realize that, yeah, I got a lot of information about not getting pregnant, contraception, but we didn't talk about my sex life and my intimacy and my relationships more broadly. And that for some people in this group, it was really hard for them to bring up those topics because they felt shame in asking their healthcare providers or talking about this stuff. Many other people feel like, and this has come up in multiple interviews as well, I've kind of been saying along the way as I've been talking for the last few minutes that the people who said, hey, sex was important to me, intimacy was important to me, I still want it to be important to me, this is how I'm going to address that. There's a whole other group of people that say, hey, this is not a top priority right now. I've got other stuff going on in my life. I have other things that come before my sexual health. And again, that is also a very normal thing to feel. And that was represented in this project as well. Also, that idea, though, that if it is important to you, there are adjustments that can be made. So, it says the impact, that second quote there, the impact was there in the physical sense at the beginning. Then there's a psychological side. Then slowly you come back to your normal sex life. Everything is normal again after the moment of adaptation. And And then also finally, there was in this one, the final topic was about attitudes toward pregnancy. I'm going to not focus on that so much here, but I think that really is sort of something to keep in terms of the context of people experiencing kind of different emotions around sex. And we can't ignore the fact that especially for people that can get pregnant and have PH, it adds a whole nother layer onto their experience of sexual health that is very relevant and important to people. And finally, there was a survey done with providers where they were asked about how often they're talking to their patients about this stuff. So we just heard from the people who are living this day to day, what they say, what's normal for them, what they'd like from their providers. How are we doing? Well, even the providers themselves acknowledge that sex and intimacy are most likely to be discussed at random intervals or when the patient brings it up. So there is an acknowledgement by this group that is not part of their routine assessment or routine conversation. And again, I think it very much varies by professional, because there was a subgroup of a few providers in this study that said, no, I ask about this every time. So it really depends on who you're talking about, and it does vary from person to person. Another thing is providers do not consistently report that they involve the partners of their patients in these conversations about intimacy and contraception or pregnancy, which I think that's something that might, again, vary by the person, the type of relationship you're in, but is something that is really not really on the radar so much, it seems like, in the healthcare field for some people. And it is the reality that there may be many patients out there who are just not having a consistent experience or not addressing this topic with their provider right now. So that is really pretty much all the research studies that you can find that are directly related to sexual quality of life for folks who have pulmonary hypertension. Now, the good thing is because we do have a lot of fantastic clinicians working in this field and researchers, there is a guide that's out that you may or may not be familiar with. I have a link to it here in the slides called Living with PH, A Guide to Intimacy. And this was put out by the US Pulmonary Hypertension Association. And it is a guide on dating, relationships, intimacy, and sex for people living with pulmonary hypertension. And the guide itself says, here in the quote, the goal is to explain how pH and its treatments can affect you and discuss ways of coping and adjusting to life changes that often accompany serious and chronic illness. Now, I will tell you, for this presentation, as well as going in and opening the guide yourself, it is intended for adult members of the community. We are going to be, as we already have started to in this conversation, be talking pretty explicitly about sex, sexual health, orgasms, lubrication. These are things that are all discussed in their positions. Now, I will tell you that if you haven't seen the guide, the little people, outline shadow people here, are the people that we have throughout. So in terms of the explicitness of positions, for instance, they do put these little guys into some different sexual positions to illustrate what may or may not work for you and give you some suggestions. But just want to make everybody aware that's going to it, that this is an important disclaimer. And also this was adapted from a guide that was put out in the UK with a similar topic. So what I'm going to spend the rest of the time talking about is really from all those research studies that I hope you all found interesting. This is the recommendations that have derived from that. So you'll see there's going to be a lot of sort of repeated topics because they said, hey, here's what we're seeing. Here's what people are telling us. Here's what we know from these surveys and interviews. What can we give people and put out there that can help you think about and get more comfortable talking about these issues if you're not already? And again, I'm speaking, a lot of this is geared towards people who are interested in sexual health, want to focus on their sexual health and on their intimacy and on their relationships. And that might not be everybody. But we do acknowledge that PH diagnosis and treatment can affect all aspects of your life, including this area. Things may be similar, things may be totally different. And it's really normal to have a range of experiences to want emotional intimacy, to want physical intimacy. And I put those two there because they are different things, although they do overlap. It's normal to have a lower sex drive after diagnosis. It's normal to want to talk about it. It's normal to not want to talk about it. It's normal to not know how to talk about it. And it's normal for all of this to change over time. So I hope I'm capturing a pretty wide range there that might apply to most of you out there. We've heard it all, and I'm sure Dr. Ventetuolo can attest to that as well from her clinical practice, that there's just, it's not a one size fits all. In fact, I'm using the term normal here, but there's actually a slide in a little bit where I'm going to backtrack on that a little bit. All of these feelings are normal, but there is really no normal sex, normal thing that you should be doing, that you should want, that you shouldn't want. It is about being creative, and it's about having communication, and it's about being comfortable. So to continue a little bit more with some of the idea, like normalizing this whole experience that you might be having, it can be challenging to keep the same levels of intimacy with a partner or to start new relationships when you're diagnosed with something like pulmonary hypertension. And here are some of the reasons why. Again, we might have hit on some of these, but the guide does a really good job, I think, of just laying out some of the stuff that might be going through your head as you're facing this. It may not seem like a top priority, as I've mentioned. There may be elevated levels of stress for you, your partner. The roles in your family and your relationship may be changing in terms of who's responsible for what, in terms of how you take care of each other, both your physical and emotional needs. It's you and your partner. The symptoms that you may be experiencing in terms of breathlessness, lack of energy, that's the physical limitation side. There's uncertainty or stress related to just your general functioning on a day-to-day basis, potentially. Maybe not right away, but potentially over time. Changes in your body image, as we've talked about, can affect people. And then there's other conditions you may have related to or not related to pulmonary hypertension that are just adding additional complications onto your life. So these are all things that are, again, very normal that many people are experiencing before and after diagnosis, and that do have a potentially real effect on sexual health. And I say this because I do, want to just kind of be aware of the challenges are very real, very present, and may or may not affect your sexual health. And there are things that we may or may not be able to do about that. So this is getting back to the idea that, sex is a priority for many people. And if it was before your diagnosis, it can still be after. There are some really positive sides to physical intimacy as a subset of different types of intimacy. It can be a good outlet for stress. It can help distract you from your day-to-day life. It can be a place where you feel emotionally safe and vulnerable with a partner. So, thinking about the positives that sex can offer in your life is something that makes say, hey, this is a really, important topic that if people want to talk about, we want to talk to them about it. But the talking part is not always easy. It can be difficult for anybody to talk about sexual health, whether you have a chronic health condition or not, whether you're in a relationship or not, whether we're talking about your partner, your friends, your family, your healthcare providers. It can be a really difficult conversation for a lot of people. People very, very much vary in their level of comfort with how much they can talk about sex or intimacy. But as you'll see, like the thing that comes through all of these recommendations is that it's really important to have open communication. And that really is sort of the underlying skill that, even though it's incredibly scary for a lot of people to talk about these sensitive topics, that is a skill that is kind of at the heart of everything that we're gonna talk about here. And so I say that to move right into conversations with your partner. So the guide also lays out some different kind of circumstances that you might encounter in terms of having or wanting to have a conversation, but not really knowing how to have it when it comes to your sex life. So one thing that people report, and also we kind of talk about some recommendations for how to handle, is maybe when you're not in the mood to have sex. Ways that you can acknowledge that sex itself might be difficult, but you still want to have time or find intimacy with a partner. So for instance, I'd love to spend time with you or cuddle. I don't feel up to having sex, but I'd be interested in trading massages. There's also, other really practical solutions that you can engage in. Masturbation can be less physically exerting than intercourse, sexual intercourse. So that's something that you can talk about with your partner if you're comfortable with that. Also, other things that can increase foreplay, using toys, sexting, using erotic literature, things like that. Sometimes if that desire isn't there, just figuring out ways that you and your partner are comfortable with bringing more of that desire in and increasing some of that arousal. And it's things that maybe you haven't tried before, want to try out. Figuring out ways to introduce that to a partner is sometimes really helpful for addressing some of that desire element when it comes to sexual health. Also, when you're focusing on issues related to your body image, again, I feel like I'm just going to say this over and over again, but communication is a really key thing. It's not an easy thing to do, but it's the key element. And so talking to your partner about the concerns that you're having, it can be really scary, but it can also, getting that out there and having open and honest dialogue can be very impactful for a lot of people. Sometimes the people don't even know that that's what your partners even know that's what you're worried about. They're not noticing the same things you're noticing. They don't think about it the same way you're thinking about it. And so having that type of dialogue can be really, really helpful in moving that forward. Also talking to other friends and family who might be able to give you a different perspective, that same kind of, oh, I didn't really think about it that way. And that can also be really helpful if you have a trusted friend or family member that you feel comfortable discussing these topics with. And this is another one with talking to, doctors, nurses, mental health care providers, looking at other resources. Like here in the US, PHA has PH mentors that may have gone through some of these experiences, can speak to that for you. That is another potential resource that can be helpful. So finding someone who may have gone through this before, support groups, things of that nature. Another situation is, a lot of what I've been talking about is assuming you have a partner. Maybe you don't have a partner when your symptoms start up or you've been diagnosed and you are interested in dating, but you don't know when is the right time to talk about, hey, I have this condition that affects me more or less at certain times. And the reality is there's not really a right answer to that. It is about when you feel safe and comfortable sharing this type of information with someone that you've met or that you're beginning to think about dating or being in a relationship with romantically. And again, I think this is such a personal topic that, this is where people like mental health professionals can really come in terms of helping you navigate, psychologists, psychiatrists, other types of mental health providers. They can help you deal with some of these, the bigger issues of when you feel comfortable, how you handle this, how you address it with people, how you talk about it. And really, again, what you are safe and comfortable with is a very personal decision that requires some thought. There's also the conversation of protection. I've already alluded to a few times, none of the medications used to treat PH at this point protect against pregnancy or sexually transmitted infections. So those are things that you still have to consider if you're going to be having sex. And because there is that additional layer of, women with PH being advised to avoid pregnancy because of the kind of physical toll that can take, there's that additional issue of having to talk to your partner about contraception that may or may not be discussed with your provider. And so, kind of that in particular is a place where if you're having some of these conversations with your provider, getting your partner involved, if you have a partner, it might be a good idea in that situation as well. And again, that's something that we know is not consistently happening, but can kind of lead to more open communication. This is where I mentioned before this myth of normal sex. There is nothing that's normal. The sex you are having earlier in life is not the sex you have later in life. whether you're diagnosed with a condition or not. It changes over time for most people. The non-normalness of it is what's kind of normal. It also doesn't have to be entirely focused on penetrative sex, having an orgasm, the very physical elements of sex, as I've already mentioned. You can kind of redefine, and using some of that open communication, what is normal sex for you now, and that's okay. The last topic I want to talk about before we close up here is a few more sort of very specific suggestions, because we know that there may be changes to your desire or ability to have sex. In addition to just communicating, what are you going to communicate about? And there's been a few suggestions of different situations where you might find yourself needing to communicate with a partner. Some other suggestions of things that you can communicate about or try or experiment with. When you are experiencing symptoms, when you do have sex, some really good ideas are picking a time of day when you have your highest energy levels. You may learn that over time. Talk to your partner about, or partners about, this is the time of day when I feel the best. Let's try to see if we can, work intimacy or sex into that. Communicating sort of when you're ready to have sex, either verbally or non-verbally. Sometimes people, I've heard all sorts of stories about something that you wear or something that you do when you want to try to have sexual intimacy that day. Taking your time and slowing down and communicating that, you might need to do that. And how am I going to communicate to you when this is not just kind of the normal breathlessness that might get associated with being physically active. Also, trying to breathe regularly. It is actually very natural for people to hold their breath during sex, and trying to continue to breathe normally while you're having sex, which may be a change from what you might instinctually do, to be able to kind of maintain your comfort level while you're having sex. And then if you do use oxygen, talk to your healthcare provider about, when you use it, if you can use it during sex, if you should be. And that's a potential that can help keep levels of oxygen and breathing more comfortable for you while you're having sex. Another thing is, and as you'll see if you look at the guide or have already, is positioning is super important. Just making sure that the person who has PH doesn't have pressure on their chest, can breathe freely. This also includes, not shockingly, communication and creativity. So talking about, hey, that position's not really going to work. Let's try something different. And, kind of even switching around to see if over time you find things that work more or less better for you. And then even within sort of one encounter, switching around so that you're not putting too much strain on any one part of your body for too long at a time. Another suggestion is to include some props or things that might help. And this takes all different forms. And many of them you might already have in your house. Pillows, towels, blankets can help prop you up in certain positions so that you feel more comfortable. You don't feel as much pressure. You don't get out of breath. If you're experiencing sort of dryness or difficulty with natural lubrication, and that's different for you, using some personal lubricants. And because I do a lot of STI prevention work, please remember that you cannot use oil-based lubricants if you're using condoms, that it will degrade them and potentially break them. But that can be a really helpful thing to add in. Also, if you're comfortable and your partner's comfortable with other things, sex toys, vibrators, things that can increase arousal, those are all great options. If you haven't experimented with those in the past and you want to, that's a great thing to bring in. If you have, but want to use them differently or more often, that's also on the table. I also wanted to mention briefly here the specific issue that about half the men on that survey that we looked at reported, which is erectile dysfunction. And this is, a lot of drugs that are used to treat PH are also used in different dosages to treat erectile dysfunction. However, people don't, you will not have the same potential effects on your sexual performance just because you were taking those drugs, because they do affect different people differently. They are used at different dosages. So if you are an individual that's experienced erectile dysfunction, that is something you definitely want to talk to your healthcare provider about, and thinking about how that interacts with the medications that you are on, and what you can do potentially in terms of medication to address that particular concern. So to wrap up here and to leave a few minutes for questions, and for anything that Dr. Ventetuolo wants to add, because I really have been monopolizing all the time here, there are, the 3 C's. I think I focus more on the first 2, but it is about communication, it's about creativity, it's about commitment. And this comes, straight from the guide. I liked this quote, so I pulled it here. It's important that you maintain a view of yourself as a whole person, and that may include your sexuality. So again, if sex was important to you or is important to you, it can still be important to you. There are conversations that people can have that if there's open communication, open dialogue, and a sense of commitment and creativity, people have, faced the challenges, but also have really found some great ways to have that intimacy and to maintain their sexual health, even as their body changes, they have physical changes, their symptoms change, their medications change. And that communication, creativity, and commitment is really at the foundation of that. And that brings me to our thank you slide, which I will let speak for itself. So we have a few minutes for other folks to speak or ask questions.
Thanks so much, Sarah. This was like such a thorough and just well-researched presentation. I can't thank you enough. I really appreciate
covered a lot.
I thought it was great that you took us through the research, although limited. I think that was a really helpful place to start. And just all the practical tips that people can just take and start to apply in their daily lives, I think is really helpful. And I'm with you. I'm a bit of a qualitative nerd. I think the quantitative stuff has a real place, but I think in this kind of topic, qualitative data, the stories really give us a nice image of maybe what the challenges are, or what ways we can start to intervene and provide support. So I appreciate all of this. I think the community is really going to enjoy learning some of these tips, especially. And I think we do have some links on our website if we don't, but I think some of our community members might be familiar with the US guide, but I will be sure to send that out, the link to the US guide to everybody following the presentation in case you don't know about it and like to download it. It's great. Corey, Dr. Ventetuolo, did you want to add anything before we go to questions?
No, thanks, Sarah. That was a great job. I think the questions actually, I don't know if you want to read them, but I've been thinking about the first one.
Sure, I'll read them out loud in case folks can't see them. But at the beginning, Sarah, you had mentioned that there was a study that showed that 67% of patients were eager and wanting to talk to their physicians about sex and intimacy. So maybe Dr. Ventetuolo, you can answer this, but how can patients approach this with their doctors? I know we've heard this a lot. There is an interest to talk, but sometimes doctors are just not comfortable, nor we've heard recently that they feel like they have the expertise to answer the questions. So patients are left without a referral to someone else and just left with these questions and now not sure where to go.
Yeah, no, I think this is a really important question, and one that doesn't have an easy answer, except to say that I think deserve to be able to talk about topics that are important to you with your care team. So I was thinking about this sort of when this has occurred in our own center, and there is some literature in cardiovascular disease that gender aligned care may be best for topics like this. And actually, in our own center, we have had a couple of patients, not many, who over the years have transiently or permanently switched within our own center to align gender with the provider to talk about tough issues in both directions, I might add. So I had a man who left my practice to go to one of my partner's practices because he had some topics to discuss around this and wasn't comfortable with me. I think that's one idea. It may not be feasible in every center. I acknowledge that PH providers, they're not as common as, general practitioners, certainly. So and not to say general practitioners are common, but I think if you're struggling with this, I think the first thing is to make your concerns kind of known. And if it's just not something that your provider is comfortable with or has the expertise to discuss, I think the other resources are, you know, members of a behavioral health team. So psychologists, psychiatrists, I think your general practitioners, internists. There are no, I think, unique aspects of sex itself and pH that, you can't kind of guess what the right thing to do is. And so the same limitations that we may or may not put on physical activity, for example, they get applied to patients' intimate, sex lives. So this I think will speak to the second question. But in general, I tell the questions I ask is like, what are you doing day to day, and what aren't you doing day to day that you want to be able to do? And I will sometimes say, is sex a part of your day to day kind of, objectives? And if it is, then we sort of come up with guardrails around how not to approach that. So that's a long answer. But I think you have to seek it elsewhere, potentially if you have care coordinators that are a part of your center, or nurses or other team members, they may be better in tune with this kind of thing. And, seeking out resources through PHA is also a great way to learn more about this topic.
Yeah, I was going to echo what you just said. Sometimes if you are a female patient and your physician is a male, you may have a female nurse. We are lucky. We've got such wonderful PH nurses in our clinics. And if it's a female and that's what you are, you may find that a better route than speaking to your male physician. Do you mind just explaining gender aligned care, just in case someone didn't?
Sure. Sorry. So individuals who identify as men, and I recognize it's a lot more complex than just binary answers, but individuals who identify as men or identify as women getting paired with, a physician or a care team member who is the same. So identified as men and or women, whichever you identify with, so that those conversations are a bit more, maybe less, I don't know, stress inducing.
Thank you. Our next question, my husband has PAH and is on meds which are made up of Viagra. I think Sarah spoke a bit to this. He seems to want sex more often, but I, as his caregiver, am afraid that he will put too much stress on his lungs. He is 75 years old. Good question.
Yeah, this is an important question. And I would say I've been surprised by how much individual variation there is in this. So a lot of, particularly my patients who are men, some of them will say it's done nothing for me, and others actually it has helped them in terms of their desire for sex or sexual quality of life. So what I would say about you and your husband is that you should talk to his provider, and if it were my patient, I would sort of say the same thing, which I usually do, which is you have to listen to your body. So if sex is putting strain on you in such a way that you are about to pass out, feeling like you might pass out, have passed out, or are beyond fatigued, then there's probably something to listen to in that message and find alternative sort of ways, and some of the strategies that Sarah discussed or Dr. Vargas discussed. But in general, if a person has been cleared to do kind of moderate exercise, which we try to encourage that in PH across the board, it should be safe.
Thank you. We have another question that came in. I'm single. We talked a bit about you're not always paired up. Sometimes you're single and looking to partner up. And because of the fear that comes with sex, I find myself refusing to even date. How would you suggest I approach this? I guess it's more of a self-esteem thing than a communication issue, question mark. And I'm also on oxygen.
I mean, it sounds like you already have some insight there into some of the stuff that might be feeding into your sort of avoiding dating. But it also sounds like there's some, desire there. There's interest while you're asking the question. This is where I would very much recommend talking to like a behavioral health provider if you're not already doing that, just to talk through this. I think it can be extraordinarily empowering to have a sounding board. If you haven't done therapy before, I'm a psychologist in background. I'm a huge proponent personally and professionally of therapy. And so I think this is the kind of situation where it seems like you just have a lot of stuff to sort through, and you need someone who has kind of the time and objectiveness to help you sort through that and ask some of the right questions. That's where I'd start. Personally, that's where I'd start.
Yeah, I agree with Sarah, and I think there are probably lots of other members in the Canadian community anyways, who are probably in a similar situation. And so if maybe you're able to connect with another PH patient who you can share stories or share strategies or share feelings of how you're doing, that might be helpful. And if you need help with that, that's something we can always do, is find another patient that we can connect you with. So
Yeah, I will say I agree, and I have actually just to inject a little bit of hope. I've had patients who during the course of their journey with PAH and infusions and oxygen and all of it have gotten married, have found lifelong partnerships, have been very happy, and so that is a possibility. I've also had patients that have met each other in the center and have gotten married. So
yeah, that's interesting. That's a great place to meet someone who totally understands what it is that you're going through, right? So okay, I don't see any more questions. I've noticed that Jamie's just put in the chat, and I will reiterate what she's written there. But if you're interested in this topic, our issue of connections for this early part of the year will feature a sex and intimacy special feature. So if you want to read more about this, especially the experience of our patients in the PH community, I encourage you to subscribe if you're not already a subscriber to Connections Magazine. You can do that on our website, but it'll echo a lot of what Sarah and Corey have said today, and it'll give you a bit of a glimpse as to what's been going on with some of the patients here in Canada. So I encourage you to do that. And Sarah and Corey, I will mail you a copy as soon as it's out in the next couple of weeks, because I know that you were eager to look at it. So we'll send that out. I just want to thank you both so much for doing this today. I really appreciate it. Sarah and I connected a couple of months ago, and we were talking about how we were doing this issue. And you did release your survey here in Canada. That's right, Sarah. We did share some of the members here on the call today. You may have completed the survey that we had shared from Sarah about sex and intimacy. So thank you for contributing to the research. Again, thank you both so much. This has just been so helpful. I think it's just so important to get the conversation started, and it's one that's been a bit challenging, but I think this will be helpful, and I think this will be one of our more popular recordings on YouTube in the months to come.
Thank you so much for having us.
thank you.